Hello, and welcome to the webinar on the Brother You're on My Mind program. This is a program that's coordinated by the National Institute on Minority Health and Health Disparities and the Omega Psi-Phi Fraternity Incorporated. Together, we're changing the national dialogue regarding mental health among African American men. I'm Kelly Carrington, Communications Director at the National Institute on Minority Health and Health Disparities, and I'm here with Shelley Pollard, our Outreach Coordinator. Today we'll cover a lot of information about the Brother You're on My Mind program. We'll give you some background, talk about who we are in IMHD, your partner, look at why we're focusing on mental health. We'll also talk about the partnerships in terms of our roles, Omegas and NIMHDs. We'll then look at some of the accomplishments we've had thus far. Shelley will then take over and talk about the toolkit, giving you the tools so that you can start contributing to some of those accomplishments, and also talking about how we can evaluate to know what's working, what's not, and what we need to change. And finally, you'll be ready with a call to action. Before we start the presentation, we'd like to acknowledge the Omega organization, your leaders and staff who have been involved with the program since the beginning. We'd like to give special thanks to the Grand Basileus, Mr. Antonio Knox, to the first Vice Grand Basileus, Dr. David Marion, and to the Chair of the International Health Initiatives, Dr. Melvin Penn. So who is NIMHD? Well, we're one of 27 institutes and centers at the National Institutes of Health. As you can see on the organization chart, we're listed over there in purple on the upper left-hand corner. The National Institutes of Health is the nation's largest federally funded biomedical research agency. And we work with all of these institutes and centers focusing on minority health and health disparities. Our mission is to lead the scientific research to improve minority health and reduce health disparities. And we do that by focusing on 5 areas. First, we foster and evaluate research on minority health and health disparities across NIH. As I mentioned, working with all those institutes and centers here at NIH. We also conduct and support research on minority health and health disparities here on the NIH campus, as well as through our extramural program across the country and abroad. We foster research training to help build diversity in the workforce, and we communicate our research results and information to our stakeholders. Finally, we foster collaborations and partnerships, just like the one that we're talking about, Brother You're on My Mind. Our director is Dr. Eliseo Perez Estable. He came to the Institute in the fall of 2015 after a 30-year research career at the University of California at San Francisco. Dr. Perez Estable focused on improving minority health and underserved population health as well. So why focus on mental health? It's in the headlines. Mental illness is a serious and prevalent condition affecting all populations. And there are conversations going on all over the country among the adults, but also among our younger generation. In fact, the young rapper Logic released a song earlier this year whose title is actually the phone number for the National Suicide Prevention Lifeline. When he performed that song at the MTV Music Video Awards just last August, the call rates for this phone line went up 50%. So there's a lot of conversation out there about mental illness and what people need to do. But in terms of our homes and communities, there's still a silent stigma. Recently, Dr. David Marion spoke about this issue when he was on the panel that Omega sponsored at the Congressional Black Caucus Foundation. Some of his other key messages: there is help out there for people, and there's no shame in getting help. So Brother You're on My Mind wants to be a part of the solution. This program was formally established in 2015 to increase awareness about mental illness, particularly stress and depression among African American men. The goals of the partnership are threefold: to start a conversation about these conditions, to dispel the myths, and to share the resources about prevention and treatment. So as part of the program, Omega members are asked to do 4 things, and we'll cover them on the next 4 slides. First, to pledge to help change the minds of the public regarding mental illness. This slide shows the pledge that Omega members were asked to take during the early part of the program. Second, learn more about mental health. This slide reflects the disparities about mental health in the African American community. 1 in 5 Americans struggle with mental illness every year. And African Americans are 20% more likely to have a serious psychological distress than whites. And for our youth, suicide is the 3rd leading cause of death among African Americans aged 15 to 24. African American men are 4 times more likely to die by suicide than black women. And the proportion of African Americans who need mental health treatment and get it is half that of whites. So also in terms of learning about mental health and mental illness, we're asking members to recognize the signs and symptoms of mental illness, to understand and overcome barriers that are unique to African American men, and to look at what you can do for yourself and for your loved ones. The third thing that we ask Omega members to do is to educate. We're asking them to collaborate on efforts to educate Omega members, their families, and related communities about the effects of depression and stress, and then to communicate the importance of seeking help by a mental health professional. Often we talk to each other, or we talk to clergy or others in the community about mental health problems, but it's important to know that you want to go to a mental health professional for the information and treatment. Finally, we ask members to partner with other organizations to have a collective impact on the outreach that's going on. This slide shows a few examples of things that Omega members can do. Finding local information, or I should say, finding information at the local level, resources and healthcare providers. Having a mental health professional speak during your chapter meetings. Displaying and distributing print materials at locations in the community where people frequent. And hosting a mental health forum. Members can also coordinate health fairs and distribute materials there. They can work with congregations and health ministries to help focus on mental health. They can also develop local partnerships, places where you can join a larger organization and have a greater impact on your outreach. Members can also encourage mayors and city officials to establish proclamations on men's mental health. So what's NIMHD's role? Well, we take more of an administrative role, if you will. We lead the development of health materials, things that you're able to share in the community. And we connect Omega chapters with resources, organizations where they can then find experts in the community to speak at events. We also support evaluation so that we can determine whether the initiative is working or not. So I've given you some background about the program and told you some of the things that we'd like to see Omega chapters do in terms of outreach in the community. Some of you have already been doing this, and so over the next few slides I want to show you some of what we call the accomplishments thus far. NIMHD has helped bring experts to the Omega meetings over the past several years at your conclave, your youth leadership forum, and your general leadership forum. This slide reflects many of the people who have been there. You'll note that early on we had Omega member and former Surgeon General Dr. David Satcher provide a keynote address at the 2015 Leadership Conference. Dr. Satcher is credited for the 1999 Surgeon General's Report on Mental Health, and this was the first public health report to raise awareness and become a catalyst of activities to address the issue. Together, NIMHD and Omega have been participating in Twitter chats, online conversations about mental health, and you can see from the slide we have reached tens of millions of people with messages about the importance of finding out about mental illness, finding resources, getting treatment, and so forth. So we're out there, and so are you. Thanks to Omega's media outreach staff, you've been able to garner an article in Essence magazine about mental health, and Dr. David Marion was featured in that article. You might know that Essence magazine reaches at least 1 million people in their subscriptions, but they probably reach a lot more through online communications as well. So the messages are getting out there in large numbers. Just recently, Dr. Marion and Dr. Penn penned an article in the Oracle Summer 2017 issue. This was a call to action for members to raise awareness about mental health and to start taking action using the toolkit and getting started in your communities. Many Omega members have begun responding to the call to host events around the country, and this slide contains just a few of those events. In Cincinnati, Ohio, the Beta Iota chapter has done something. In Washington, D.C., the Alpha Omega chapter has held an event as well. And finally, in Atlanta, the Phi Kappa Kappa chapter has also held an event. And again, Dr. Marion has been very active on Twitter. Now you've had the background of the program, and you've had examples to see how to get involved. Next, Shelley will tell you a little bit more about the toolkit. She'll show you how to use it and how to get engaged and involved in evaluation as well. So with that, I'll turn it over to Shelley.
Hi, as Kelly said, my name is Shelley Pollard, and I'm the Outreach Coordinator for the Brother You're on My Mind initiative. And today I'm going to walk you through the toolkit. So what is the toolkit? The toolkit's going to provide the materials that you need to educate yourself, your fraternity brothers, and the community about the impact depression has on African American men. So how can we find this toolkit? There are 2 places you can find the toolkit. The first place is at the NIMHD website, and I've provided a link on the slide. The second location where you'll find the Brother You're on My Mind toolkit is probably where you're more familiar, the OPPF.org website. If you click on the website under the Programs tab, there's a down arrow and you'll find the Brother You're on My Mind is the last link, and it'll take you directly to the page. So once you get to the toolkit, what will you find there? Well, there are 5 sections to the toolkit, and we will cover each of them today. And I will spend the majority of my time on the evaluation section because that section is new and has a new process as well as new materials. So let's talk about the toolkit. The first section is the education material. Here you're going to find 3 fact sheets that'll talk about depression in men in 3 different age groups. It's a great tool for you to educate yourself as well as to distribute at your Brother You're on My Mind events. Section 2 of the toolkit is going to be the community outreach and partnership information. Now we know Omega Psi Phi Fraternity Incorporated has already done a phenomenal job of partnering with organizations about the Brother You're on My Mind initiative, but this section will give you some additional tips and tools to help you make sure you're reaching the right people and partnering with the right organizations. Here's a screenshot of what you'll see when you go to those sections about the community outreach checklist and the tips for forming those partnerships that will be long-lasting. Now let's move on to Section 3. There are 3 things in Section 3 that I want to highlight. So Section 3 is event planning, and the first one is the event planning checklist. This is a great resource for you to use. So as you're planning your event, it tells you what you need to be thinking about long range, like 3 to 4 months, as well as what you need to be doing the week of, the day of, and the day after your event. Also in Section 3, you're going to find the locating mental health treatment. Now I want to stress, the goal of the Brother on Your Mind program is to start conversations about African American men and depression and stress. In no way is the program geared to making you mental health providers. But we do know that when you have conversations with people about difficult topics, oftentimes you meet people who are in distress. So we always encourage you to have mental health providers at any Brother You're on My Mind event you host. And we also, in Section 3, provide a list of mental health treatment organizations where you can send people to if indeed they need additional help. Also in Section 3, you're going to find some event planning material. So the first thing you'll find in that section is the PowerPoint presentation. So the tips and statistics that Kelly shared earlier, as well as the things that I'm sharing right now, all came from the PowerPoint presentation in Section 3. We highly encourage you to use it and doctor it to what your needs are for your activity. Also in this section, you're going to find some handouts. These are great ways to make your presentation more interactive, things you can pass out during your event, like true-false questions, practicing the ask for people who are in distress or who you think might be depressed. Great resources. Again, I highly encourage you to go to Section 3 and pull down that information. All right, we're almost done. We're on Section 4, and Section 4 is going to be your promotional material. So we've already talked about why to do the event, information to educate yourself about the event, and checklists for planning your event. Now let's talk about promoting it. This section is going to give you all of that material. The first thing you'll find is a template for a flyer. All you have to do is change the name to your fraternity's chapter, and you're ready to go. There are also some great sample messages for everything from Facebook to Twitter to Instagram. Along with the messaging, there are also images that you can use to really help get your message across and promote the great event you're planning. All right, we've come to Section 5, and Section 5 is evaluation. And the evaluation section is very important to us at the National Institute on Minority Health and Health Disparities, but it's also important to Omega Psi Phi Fraternity Incorporated. As Kelly mentioned earlier, Dr. David Marion and Dr. Melvin Penn wrote an article about the Brother You're on My Mind initiative in the summer edition of the Oracle. And in it, they talk about the importance of data collection. I'll quote what they said. We're encouraging all Omega chapters to help with the data collection by being part of the national count of future Brother You're on My Mind efforts. So if you got your charge, how can you do it? Let's talk about it. There are two sections in the evaluation. First is going to be the after action report, which is new, and also the participant assessment, which is also new. So in Section 5, the after action report is going to be an online form. I've provided the link in the slide, and it's also on our website. This is going to be the preferred method for submitting your responses. So what happens when you go to the link? It's an easy form. It's 15 short questions. The format counts you down to completion. You check done, and it not only goes to a resource that's available to us at NIMHD, but also to Omega Psi Phi headquarters. So it's important, again, that you complete the online form on SurveyMonkey. Here's a screenshot of what the form looks like. It talks about everything, as I said, from counting you down to completion, and then a box that says done, and then a thank you for submitting. Easy to complete. But I do know there will be some people who prefer the online format. So in Section 5 of the toolkit, you will find the same format in a PDF that you can download and print. The one caveat, though, is at this present time, we're asking you that if you do complete the hard copy, that you go back and input the information into the online survey. So again, we want you to print it off. You could possibly take it to your fraternity meeting after your event to get input from your whole committee about the things that happen at the event, but then we ask that someone in your chapter go to the online form and input the information so we can have it, as well as Omega Psi Phi Fraternity Incorporated. All right, the other section for evaluation is the participant assessment. And the Brother You're on My Mind participant assessment is going to measure the knowledge, attitudes, and beliefs of the people who attend your BYOMM event. The form's a little bit longer. It's 24 questions, and it asks them how they felt prior to your event and afterward. And there are going to be 2 ways you can collect this information from your participants. The first method is going to be a hard copy assessment form. So if you had an event with your local church and you had 25 to 40 people attend, you could pass out the form at the end and collect them from the participants. Again, it's easy to do. Here's a screenshot that shows the actual form. So this second way participants can complete the Brother You're on My Mind participant assessment is online. Again, this is going to be the preferred format. Here's the link. It's the same form as the hard copy. It'll take about 5 minutes to complete, and you could put in the link on a slide and people could pull out their cell phones and complete the form. But because at this time we are going to ask that if you do have an event and you do hard copies, that your chapter collect them and then put the data in on the online form. We'll talk a little bit more about that during the question and answer survey, but again, for any of the participant assessments that you do by hard copy, we ask that you complete it later through the online SurveyMonkey form. And in conclusion, we'd like to end with 3 action items for Omega chapters. The first one is easy. We just ask that you go to the website and review the Brother You're on My Mind toolkit. The second one is we ask that you plan a Brother You're on My Mind event, whether it's your first, your second, or your third. We ask that you plan one. And then we ask that you complete the new evaluation process. Remember, there are 2 portions, the after action report and the participant survey. Both can be found online. And I'd like to end with this Swahili word that means I see you. The National Institute on Minority Health and Health Disparities wants to say, I see you to every Omega Psi Phi Fraternity Incorporated chapter. We see the great work you're doing in your communities, in your chapters, to help raise the national voice about African American men, depression, and stress, and we thank you. Will now be a slight pause while we review your questions and continue on with the question and answer portion of the webinar.